things that improve the health of the gut have a attenuating impact on the activation of the center in the brain known as the limbic system. This leads to less perceived stress, less anxiety, less depression, healthier cortisol levels, and also improvements in cognition and memory. Regarding the connection between your gut and the stress response. Now, the stress response is kind of broad. This could mean someone's anxious, depressed, has poor memory, has poor sleep, just to name a few. Or they may just notice that they're intolerant to stress, right? They're trucking along okay, but they notice any even seemingly small amount of stress can tip them over into being depressed, being anxious, sleeping poorly. We're honing in on an important area of the brain known as the limbic system. This region contains the hippocampus, the thalamus, the hypothalamus, and the amygdala. And specifically, it seems to be this amygdala that is one of the more key areas for us to focus on. It's an almond-shaped gland or region in the medial temporal lobe. And the amygdala governs a few different functions. Emotional processing is one of the most key, but also memory. And if you think about this through a evolutionary lens, the fact that we spent over 1 million years as hunter-gatherers, over 600 generations of people evolved under the pressures of hunter-gatherer living. Well, why is that relevant? Because if you watched your friend eat these, let's say, berries, and then throw up for 4 hours and die, it would be very important to your survival that that berry was driven deep into your memory. And it's in part the amygdala that governs this function. Now, what seems to be happening modern day is, for a variety of reasons, the amygdala is overactive. This may lead to poor memory, but it may more specifically lead to tagging events that are not dangerous or should not elicit a stress response as ones that do elicit a stress response. This is the overactivation of the amygdala or overactivation of the limbic system. And this is a problem because we know that overactivation of the amygdala correlates with an overactive immune system. In fact, in some very elegant studies, they correlated amygdala activity through functional fMRI scans with depression or anxiety, along with more inflammatory monocytes or more inflammatory blood when administering things like endotoxin or LPS. So if you've heard of leaky gut, one of the things that leaks through leaky gut is LPS. This one study in particular found that hyperactivity of the amygdala correlated with blood that was more pro-inflammatory, more reactive to LPS, which leaks through the gut. So, all of this to sort of maybe bring us to this schematic to tie some of this together for you. So in healthy physiology, we have normal emotions, we have normal immune tolerance, we have a normal gut microbiota, so normal flora, the resident bacteria, fungi, some protozoa, those are all in balance, and you have an intact barrier. That's what you're seeing depicted here by this schematic. Now, in stress physiology, we have depression and anxiety. We have an overactivation of the immune system, like I described a moment ago in these elegant studies showing that people's blood is more pro-inflammatory when they're under stress and or they have a heightened activation of the amygdala. This correlates with dysbiosis. And if you think about it, the resident or commensal microbiota is policed by your immune system. As an example, in inflammatory bowel disease, there's a skewing and imbalance of the bacteria because the immune system is actively attacking the bacterial colony. So part of what can lead to a healthier microbiota is a healthier immune system. So this is the dysbiosis tie-in. And then along with that, you have altered barrier function. So this is the leaky gut. And when things leak through the gut, like LPS, you can have this immune activation. Are you starting to see how a perfect storm or a snowball can perpetuate here? If you have overactivation of the amygdala, You can have disrupted barrier function. Too much stuff leaks through, hyperintestinal permeability, or leaky gut as it's used as sort of a contemporary definition. And this is happening in the context of a heightened immune response. So this is the snowball that we're trying to avoid and we're trying to move into the direction of healthy physiology. And again, the key finding I want to bring you to here in a moment is that what's going on in the brain impacts the gut and vice versa. And by the way, if this has been helpful, please comment and subscribe. This really does help us reach more people who are trying to improve their health. So it is quite deeply appreciated. Because the vagus nerve, again, is part of this sort of parasympathetic chain that extends from the brain all the way down to the adrenal glands located on top of your kidneys, you can see aberrancies in stress hormone levels, stress response, and in the hypothalamic pituitary axis. Starting in the brain, we'll kind of work our way down. Poor memory. Now, the top of this chain involves two key brain centers, the hippocampus and the amygdala. The nervous system should be able to swing like a pendulum from sympathetic when you need to be on, like me right now. I need to be sympathetic, attentive, pulling these different pieces together, having this conversation. But then after I eat lunch, let's say, or dinner, my nervous system should swing back to parasympathetic, or even better yet, when I'm trying to go to sleep. This is something that I think haunts a lot of people, in that they don't seem to have that appropriate swing. They might get swung too far sympathetic. They're anxious, they have insomnia, and then they have periods where they're forgetful or they can't sleep. And this is because the autonomic nervous system pendulum is not functioning well between sympathetic fight or flight, parasympathetic rest and recover. And the vagus nerve resides on this side of the autonomic ledger, if you will, on the parasympathetic side. So by fostering better function or tone of the vagus nerve, we have better parasympathetic function. That's your rest, digest, and recover. There's also a key concept here that we should address, which is stress. So work stress, financial stress, relational stress triggers you to be sympathetic, but also, key point, inflammation triggers the sympathetic nervous system. So if you've had joint pain or abdominal bloating or discomfort, any type of inflammation, swelling in your fingers, this inflammation all skews you sympathetic. And what ends up happening is the more sympathetic you are, the more sympathetic you become. So this cascades where you're more sympathetic, you're more stressed, you're more sensitive to stress, you're also more inflamed and more sensitive to inflammation, and it leads to this self-feeding cycle, which can be interrupted, and that's what we're going to discuss in the body of the protocol. But this stress inflammatory cycle is a key point, I think, and an overlooked component of a lot of dysfunction and symptoms modern day. Take this one case in point from a 2023 review paper. Inflammation activates the sympathetic nervous system, the SNS. And when inflammation becomes chronic, the sympathetic nervous system is persistently elevated. So inflammation triggers you to become sympathetic. Here's the other side of that cycle. 2021 clinical trial. In individuals who were under high amounts of stress, they actually had more inflammation in their blood as compared to people with normal levels of stress. And that's what you're seeing here. LPS, lipopolysaccharide, is one of the particles that will leak through the gut. Some leakage is normal. Okay, so we're all going to have some degree of LPS, or bacterial wall membrane fragments, leaking through. But here's the problematic part. People who are stressed have an exacerbated response to these particles. So if you're someone who feels like you're sensitive to foods, let's say maybe dairy or supplements, this might be why. Now, in this study published in Cell, they looked at 4 different cytokines, 4 different inflammatory markers. And what you see here is the heightened inflammatory response in 3 out of 4 of the cytokines measured in those who are under stress. So the stressed cohort, stressed versus non-stressed or normal, the stressed individuals had a significantly higher level of inflammation when exposed to the same stimuli as the non-stressed individuals. So this is the cycle. Environmental or psychological stress paired with inflammatory stress leads to this chronic runaway, both stress and inflammation, part of the same cycle, again, which can be interrupted. But I wanted to make sure to tie this in because for some people, I think they're looking to resolve this exclusively via, let's say, anti-inflammatory supplements or diet, which is all fine and good, but they might be missing this key part of the parasympathetic nervous system and the vagus nerve therein. Enter a 2023 randomized control trial, 45 healthy adults who were self-reported to be under moderate to high levels of stress. They didn't rate themselves as normal stress or eustress. They were given Bifidobacterium longum versus placebo at a dose of 10 billion CFU per day. Interestingly, the probiotics reduced stress by 21%. Again, I would take about a quarter reduction of stress any day. Now, there's a combination of things examined here: self-reported, subjective stress questionnaires, how stressed do you feel essentially in a peer-reviewed stress inventory. But get this, and I'll quote, perceived stress correlated with a reduction in anxiety, in depression, and in the cortisol awakening response. So what they documented was as the probiotics led to that 20% or 21% reduction in perceived stress, it correlated with less anxiety, depression, and in the cortisol awakening response. Probiotics have a beneficial impact on the stress response. 2023 randomized control trial, 129 healthy adults with stress. Again, they were given lactobacillus, in this case plantarum, so different probiotic, 10 billion CFU, and they documented that the probiotics improved memory and cognitive function. We talked about the stress response, anxiety, depression, and cortisol, but what about memory and cognitive function? Well, it turns out that if you have an overactivation of the limbic system, you'll have higher anxiety, higher depression, and you'll also have correspondingly poor memory. So the underlying physiology is probably the same. Things that improve the health of the gut have a attenuating impact on the activation of the center in the brain known as the limbic system. This leads to less perceived stress, less anxiety, less depression, healthier cortisol levels, and also improvements in cognition and memory. Part of the reason why I'm such an advocate for probiotics is research like this. Never to say any one tool will be a cure-all, but shucks, it would be a real travesty if someone didn't make sure to go through a thorough probiotic protocol if they were trying to improve their health. And the final study here I wanted to share, 2023 randomized control trial in 152 overweight adults. They were given Lactobacillus rhamnosus, so a different type of lactobacillus. The dose was not listed in this study, and they found probiotics led to a slightly different improvement in stress. There was less binge eating and less food cravings. Now, I haven't experienced this in quite a while, but I do remember distinctly two things helped me to deal with organic chemistry midterms, finals, exams. And one of them was chocolate and sweets. In fact, my buddy Dave used to jokingly bring me a chocolate chip cookie when we were going into study blocks because he knew that I would just have cravings. Now, I think I'm quite a bit healthier now than I was then, but it's just to articulate the point that many of us have probably experienced that stress can spur food cravings. Now, in all these studies, they used a dose of 10 billion CFU per day. The probiotics were different, right? So single species, different species, all showing benefits. Part of the reason why we continue to summarize this data into the meta protocol, use a lactobacillus and bifidobacterium blend, and this way you're going to get the different species as have been used as single species in some of these studies, but also other studies have used a combination. And there's a trend, it's not conclusive, but there is a trend suggesting that a blend is better than a single species. Heart rate variability tells you the variability of your nervous system to swing from sympathetic, high heart rate to parasympathetic, low heart rate. So if you're noticing that you have low HRV, that tells you that you don't have much amplitude in the swing of the pendulum. A 2016 study found that 400 milligrams per day of magnesium improved HRV. Now, they used a form that was magnesium oxide combined with aspartate, HCl. My view, even though I don't think there's adequate data to support this yet, is that the other forms that are known to have better bioavailability, like glycinate or threonate, will probably be best for modulating the nervous system due to their absorption. As context, if you're trying to help someone move their bowels, you actually want to favor the forms that are less absorbed, so they pull more water into the bowel and help people with constipation and with regularity. So oxide or citrate might be better in these populations. But if we're trying to get the best absorption, gut and then into the brain, again, I think glycinate or threonate are probably better bets. And then a final couple to consider, this is not an exhaustive list, would be a good clinical dose multivitamin. The following have been shown to improve HRV: vitamin D, vitamin B12, vitamin C and E, antioxidants, zinc. Speaking of antioxidants, CoQ10 and separately acetyl-L-carnitine have both been shown to improve either HRV or dysautonomia, another way of measuring dysfunction in the nervous system. And then a touch more speculatively, some anti-stress either nutrients or herbs like L-theanine, rhodiola, ashwagandha, and ginseng, I think are worth considering including into a plan to help support that pendulum. As we transition to some of the other supports, I wanted to share Jasmine's story. She is our wonderful office manager. She's the best. Sadly, she was having low blood pressure, dizziness when standing, very, very poor sleep, and anxiety. Now, her conventional doctor recommended an antidepressant and a beta blocker, which, with no other option on the table, okay, but Jasmine did not like the way she felt on these, and I would agree that they are really masking or treating the symptoms but not addressing the cause. When listening to what was going on with Jasmine, it seemed fairly clear that she was burnt out and there was lack of vagal tone or lack of that parasympathetic activation of her nervous system. Two things were recommended to her: a vagal nerve stimulating device and electrolytes. And here is Dr. Scott from the clinic. He was working with Jasmine and he has a few more details.
Within about 2 weeks of Jasmine starting the vagus nerve stimulating device and the electrolytes, she reported she saw a dramatic improvement in her insomnia, where she was now sleeping 6 to 7 hours per night, which was a big increase from her previous maybe 3 hours or so per night. Her heart palpitations have also improved significantly, as well as her anxiety, to the point where now she is no longer on the anxiety antidepressant medication, and she's actually in the process of weaning off of her beta blocker because her heart rhythm is just that much more stabilized and she no longer needs the medication. And I want to quote Jasmine. She had let us know, "These treatments have been a game changer. I'm beyond grateful for these recommendations, and I'm starting to feel like myself again."
So amazing, Jasmine. I'm so glad you're feeling better. And I would call this a home run, or if not a home run, at least a good base hit, clearly moving us in the right direction. So this brings us to the second technique, which is the use of a vagal nerve stimulating device. So there are two ways this can be applied: carotid or over the neck, or alternatively in the ear, what's known as auricular. My recommendation would be using an auricular or ear, essentially a headphone application device. What we've been recommending at the clinic, what Jasmine has used, is a product known as the VaguStim. Simple headphone. It's easy to use. As you can see from this photo here, it is inexpensive. And I favor this over other options, which are mainly the carotid or over the neck. I find the research regarding the auricular more compelling. There's a broader swath of conditions that have been studied. And also, and this is just more so my bias, but if we're trying to retrain your nervous system and some of these key regulatory centers in the brain, like the amygdala and the hippocampus, I just don't think you're going to have a retraining effect in a short treatment duration as you see with the neck application, which is usually about 2 minutes per treatment. The trend you see in a lot of therapies for the nervous system is you want to have a lower amplitude of stimulus over a longer period of time. That's just sort of my interpretation. I can't say there's been a comparative, to my knowledge, there has not been a comparative study. But all that to say, my recommendation would be the headphone or auricular application, easy, not expensive, and I think it'll probably have a better impact on attuning the nervous system in that direction of being parasympathetic that we're trying to target. Now, let's discuss some of the very exciting research regarding how devices like the VaguStim can help balance the brain and shift you more parasympathetic. These vagal nerve stimulating devices have been shown to increase the function of the vagus nerve, which through their cholinergic pathways are strongly anti-inflammatory. See, the vagus nerve, in part, will release acetylcholine. And acetylcholine can be strongly anti-inflammatory. It will inhibit mast cells. So mast cells are part of what underlies the allergic response and leads to high levels of histamine. Acetylcholine in the vagus nerve also inhibits macrophages, which release a number of inflammatory cytokines, kind of like that slide we showed earlier with the stressed versus non-stressed people having higher levels of inflammatory cytokines in response to stimulation with LPS. Additionally, the vagus nerve and the resultant acetylcholine will modulate T helper cells and dendritic cells. Coming back to the food allergy analogy, let's say dairy, part of what might be causing a response, a negative response or reaction to certain foods is if your T cells are tagging foods inappropriately, telling your antibodies to attack that food. So by modulating the T helper cells, we can decrease the amount of targeting of food and environment particles that can lead to an incorrect inflammatory response. And the dendritic cells work very similarly in the sense that they present antigens to the immune system. And if you do so, again, taking dairy as one example of many, incorrectly, now you start reacting to foods or environmental triggers or supplements that you shouldn't, because the way that the T cells tag or the dendritic cells present is not functioning correctly. The immune system is overzealous. You are too inflammatory, too reactive. But like I always say, show me the outcome data. So there's been a number of studies here. One I found very compelling. A meta-analysis found decreased inflammation as C-reactive protein, interleukin 10, and IFN gamma, so all inflammatory cytokines, decreased stool calprotectin in inflammatory bowel disease patients, and improved rheumatoid arthritis severity. Now, if you're saying to yourself, hang on a second, I thought that acetylcholine was used for memory, for stimulation. We've talked about how nicotine, caffeine, even this club moss called huperzine A, all increase acetylcholine and help with cognition and function. It depends where the acetylcholine is being released. If the acetylcholine is being released on the sympathetic side, then it's very stimulating and it's not anti-inflammatory. It has merit, but we need that balance. So when we have better function of the parasympathetic nervous system, the rest, digest, recover, and we have the acetylcholine released there, that's when it functions as a very powerful anti-inflammatory. So just to clarify, acetylcholine functions throughout the entire nervous system. Depending on what side of the pendulum it's released, it will either be potentially pro-inflammatory if excessive, and if we don't have enough counterbalancing on the anti-inflammatory parasympathetic side, you can have a net inflammatory outcome. So one of the things that underlies autoimmunity is inflammation. So it's probably not surprising to see a clinical trial documenting reduced inflammation and autoimmunity by using these vagal nerve stimulating devices. This study I thought was remarkable. They used this non-invasive in-ear application like we covered a moment ago. What was so beneficial about this setup, it was double-blind sham, meaning someone got a headphone that didn't do anything, They thought it was, but it wasn't, versus intervention. Now, they found improvements in this orthostatic tachycardia, meaning you get up, your blood pressure cannot accommodate, you get dizzy, your heart races, you feel anxious. So that improved. Primary endpoint. Secondary endpoints also improved. Decrease anti-adrenergic antibodies. That is one of the autoimmunities that underlies this POTS syndrome. Decrease inflammatory cytokines and improvement in cardiac autonomic tone, or HRV. And what you see here is baseline scores between sham and active are similar. And then you see the active control group has a drop, which you want, in heart rate. They have an improvement in the heart rate, so they no longer have this racing heart, which is part of this POTS syndrome, by a simple intervention of wearing these headphones for essentially 20 minutes twice per day, in this case for 2 months. Now, we've also talked about how the brain has this chain parasympathetically, and it also includes your gut. So if we have adequate vagal nerve function, we can improve things like constipation, diarrhea, and reflux. In fact, trials have documented benefit for reflux, for constipation, by improving motility with the use of these vagal nerve stimulating devices. One ubiquitous trigger is constant stimulation. Devices like cell phones, computers, tablets secrete blue light that interferes with this day-night rhythm we talked about regarding cortisol, and that should correlate with the cortisol being low at night and also melatonin being high. The blue light and stimulation at night reduce melatonin, therefore thwart sleep, therefore are stressful. Also, you've probably heard this, but there's a direct correlation between degree of social media and smartphone use and depression and anxiety. So reducing as much as you can here would be helpful. Your sleep hygiene. There's 3 components to healthy sleep. Consistency, going to bed and waking up roughly at the same time every day. Duration, how long you sleep. Minimum 7 hours. Ideally, 7 to 9 hours is the sweet spot. Less or more consistently is a problem. And then thirdly, intensity. How soundly do you sleep? Are you waking up 3, 4, 5, 6 times a night? That would indicate low or poor sleep intensity. Also, work stress, financial stress, relational stress. I understand that these are more or less modifiable in different situations, but I would say just do the best that you can. And then finally, there are dietary triggers or stressors. Caffeine. Now, I'm not saying that you should get your caffeine consumption down to 0, because there is clear, and we'll link to the review we did on benefits of caffeine and coffee, because I think that's worth double clicking if this interests you. I think it'd be incorrect to say that, oh, everyone's stressed, so therefore no coffee, no caffeine, because there are clearly neuroprotective, so brain protective benefits and other benefits secondary to the polyphenols in coffee, plus or minus caffeine, and from caffeine in and of itself. 200 to 400 milligrams per day seems to be the sweet spot. So if you're consistently going over 400, this is where there's probably, or there's more likely to be problems. So reasonable, moderate, 1, 2, 3, either cups of coffee or shots of espresso per day, that is a reasonable intake. But many of you have probably noticed if you drink too much caffeine, you have anxiousness, poor sleep, what have you. And this is due to overstimulating that pendulum to that sympathetic side. Alcohol. I would be as prudent with alcohol consumption as you can. And also ultra-processed food, probably not surprising, but that is not going to help anyone in any place. So caffeine, moderation. Alcohol, I would be even more moderate. And then also very moderate or as minimalistic as you can with ultra-processed food. Singing, humming, and chanting, all of these directly stimulate the vagus nerve. Additionally, meditation and hypnosis have also found benefit for increasing the tone of the vagus nerve. There's a few others like exercise, yoga, and cold exposure, all of which we want to load appropriately. Too little, you won't have any benefit, but too much can be overly stimulating, because all of these Exercise, yoga, and cold plunge, if they're done excessively, may swing you too sympathetic. Yoga is a bit more in the gray for some obvious reasons. If it's a very gentle flow yoga like vinyasana, then less likely to be overstimulating. However, if it's a 90-minute heated Bikram class and you're doing that 7 days a week, that might be too much stimulation. And the theme with these is they'll push you a bit or a lot sympathetic, and then the recovery is where you get the parasympathetic. So if you feel you're kind of burnt out, if you're tired, you're not sleeping well, that's where gentler exercise, yoga, and more moderate or tempered use of cold plunge is probably the right way to apply these. Looking at the impact of meditation, 10,000 subjects with anxiety, sadness, and or stress were given a meditation app called Insight Timer. And they found that meditation was effective for improving either the anxiety, the sadness, and or the stress when people practiced it 4 to 7 days per week. They didn't find that the length of the session had an impact. And this, I think, is very crucial. You'll sometimes hear someone say, oh, I meditate for 45 minutes per day. And my internal response to that is, boy, where do you find the time? And if you're someone who is being told, well, it's got to be 20 minutes. If it's not 20 minutes, it's not sufficient. And then you therefore don't meditate, you might miss the key finding from this fairly large study, which was consistency was more important than duration. And the 4 to 7 days per week was the real mark to try to hit here. But again, not giving yourself a quota regarding time. And this leads to the researchers' comments. Our findings suggest that it was the consistency of practice, not the length of individual sessions, that was the most important predictor of change. One thing to keep in mind, and as I say with diet, don't let the perfect be the enemy of the good. So here that same thing would apply.
A number of research papers over the last 12 years or so show how chronic stress is one of the leading causes of the 6 main killers in the world today, including cardiac issues, cancer. All of these things are caused by chronic stress. And chronic stress triggers inflammation in the body, right? All of this is linked to inflammation. So the sky breath has been proven to reduce chronic stress in practitioners in as little as 2 weeks. And the impact of that lingers. Actually, there was a study that was done at the Palo Alto VA for many veterans who had served in Vietnam and Iraq and were struggling with PTS. And what the research shows is that even after the first practice of this breathing technique, their level of serum cortisol falls by more than half. And with a regular practice, for those who practice this over a period of time, you find that your regular level of cortisol, the stress hormone, is already like below half of somebody who doesn't practice this. The sky breath meditation stands for Sudarshan Kriya Yoga. So Sudarshan in Sanskrit means proper vision, and Kriya is action. So proper vision through the purifying action of the breath. And yoga in Sanskrit means to join. Join what? Join the mind, which is doing its own thing, flying around all the time, to the present moment, using the breath. So this was a technique that was created or cognized by Gurudev, Sri Sri Ravi Shankar of the Art of Living, the founder of the Art of Living, way back in the early 80s, in 81.
Hmm.
And since then, this program, it's a 8-hour program that is spread over 3 days. Typically, you learn it on a Friday, Saturday, Sunday, couple of hours each day, maybe even 6 to 8 hours, depending on where you are. And you learn a set of different breathing techniques that you practice on a daily basis. It takes about 20 minutes in the morning. And because you're using the breath, it helps harmonize the emotions, the thoughts, with your body. At the end of it, it takes you to a natural state of meditation where the thoughts have calmed down, the mind is clear, and in that state of clarity, you're able to, really perceive, as I shared in the beginning, perception, observation, and expression. All of these are in a better place. And with that greater energy, when you don't have to deal with all the clutter inside your mind, all of the interference, you're able to then take on so much more. Even if something was taking you like 20 minutes or 30 minutes to complete a task, you find that when you're present, when your mind is there, you're able to do it in a shorter time and you don't make as many mistakes. So it's been really fascinating. And this program is offered in more than 180 countries today, Michael. So
Wow.
it's something that a lot of volunteers have taken up. This is a completely volunteer run organization, The Art of Living. Um,
Hmm.
and it has over 35,000 instructors around the world.
How do people learn this?
So both online, this is something that we learned that we could teach breathwork online during the pandemic and also in person. So we have centers around the world. For instance, here I am in our Washington, D.C. center, which is on Meridian Hill, just a mile from the White House. So we have places around the country, around the US and around the
Yeah.
world.
Alrighty, guys. Well, hopefully you found this as interesting as I did, and I'll talk to you next time.